Hi, everyone. Dr. Hess here with a quick overview of Chapter 13, or sexual disorders. A lot here, and obviously a very controversial and rapidly changing area in the world and in our lives. Sexual identity, sexual gender identity, is very, very fluid nowadays. Most people are looking at it. Things are changing, and terms are changing, and the way we think about ourselves and others is rapidly changing as we learn more and more about ourselves. And so I'll attempt to cover the chapter as what we have in our chapter, and just so you know that I know that things are moving quickly in this area, and there's no way to really pin down our sexuality. Is way too complex for us. So let me, with that little thought there, let me bring up our PowerPoint, and we'll soldier on as we can. All right, here we go. So if you remember back in our Intro to Psych class, we did talk about the sexual stages, function stages of males and females, going through different phases of arousal to orgasm and resolution. Gender identity in our book is defined as our perceptions of ourselves is either male or female, or somewhere fluidly in between. This is those phases that I was talking about, the sexual response stages that were brought to us way back when by Johnson, Masters and Johnson. So let's talk a little bit about sexual dysfunctions. This is the area of that psychology is looking at to help people with this area. This is an important area for most of us, as far as our own identity and our own drives and our own attractions and our desires to be with others. The sexual dysfunction to be diagnosed has to occur most of the time for about 6 months, according to the DSM, and causing significant distress or impairment. And it's not due to another kind of psychiatric problem, or, and I might add, a kind of some other kind of disease or medical problem. So here are the different arousal disorders and erectile disorders, orgasmic disorders, early ejaculation disorders, delayed ejaculation disorders, and pain and penetration disorders. I'm not going to go into detail of them. If this is an area that you're interested in, delve into it with either Google or our textbook. Again, I'm really just trying to keep these videos very short and as an overview for this. Some biological causes for sexual dysfunction are recreational use of drugs or alcohol, any type of infections or things can cause also some problems for us, and hormonal issues from both male and female can cause a lack of desire or a lack of functioning in the sexual area. A lot of times, people who are suffering from depression, anxiety have these kind of sexual side effects of affecting their sexual life if they have partners. And oftentimes, some of our psychotropic medications, like first-line antidepressants or anti-anxiety medications or antipsychotic medications, mood regulators, all of these medications can have deleterious side effects to our sexual functioning or our sexual desire. Performance anxiety is kind of, I think, an important thing too. It's an anxiety around how we function in the area of sex, and oftentimes can lead to this performance anxiety can lead to overthinking. Overthinking is not something that is conducive to the free flow of our sexual activity. So let's talk about obviously the cultural and religious aspects of this area in our life, things that we were taught about it from our families and things that we heard about it from our religious leaders can have a heavy influence on how we think about that cognitive part of this area of our life. We have lots of medications now for erectile dysfunction and can be very useful for people who are having this issue, again, for longer than 6 months. And again, hormone replacement therapy is used both in male and female, estrogen and testosterone. Couples therapy and sex treatments for dysfunction is kind of important. Being able to communicate with the help of a therapist in this area can be very helpful for couples who are having issues with their sexual part of their lives. Sensate focus therapy is probably one of the most used sex therapy or sex counseling techniques. It basically starts out with some non-demanding communication between the couple, non-demanding touch, and then leads to slowly through these exercises, helping the couple come to being more comfortable, better communicators in what they want in the bedroom. Some other things. Let's see, the paraphilic and the fetishistic disorders are here. These are disorders that have to do with non-living objects being the source or the focus of the arousal. Sexual sadism or sexual masochism is also in this area. Again, not necessarily a disorder unless it is causing distress within the individuals. Voyeurism, watching other people have sex or things. Voyeuristic disorder is basically a compulsive need to do this, and oftentimes it can lead to being arrested for being what used to be called a peeping Tom. Also, there's exhibitionism, where people will expose themselves to others in a compulsive way, also leading also to arrest and jail time. Let's see. The pedophilic disorder is basically having fantasies or urges to have sex with underage children. Again, where this is actually acted upon is criminal and can lead to jail time. And we have that. Let's see here. Let's keep going. So a lot of the treatments for paraphilias and pedophilia have to do with decreasing the urges or decreasing the sex drive of this. And there are some ways that we can do it as far as using different drugs. And again, some of the selective serotonin reuptake inhibitors are antidepressants, have a side effect of lowering sex drive, so that can be used. And if there is, of course, there's aversion therapy, which is coupling, using kind of conditioning a adverse feeling or pain or thoughts having to do, coupling it with the behaviors that we are trying to extinguish or get rid of. Let's see. Most of us are probably pretty aware of all this if you're this gender dysphoria. Again, we probably all know people who are experiencing this. It's only a dysfunction in the DSM if it, again, is very distressful to the person, and is not a disorder if the person is comfortable with transitioning or their fluidity of their gender. Let's see here. And we have come to the end of our slideshow. If you noticed, I was very careful in the way I was trying to talk about these disorders, because again, things are changing day to day, and I want to leave this area of disorders as open as I can to it without labeling people as having problems. Again, I think we've learned our lesson in the psychological scientific world, that we want to be very careful with this. In the past, the American Psychiatric Association has labeled homosexuality as a mental disorder, and it is no longer. They removed it from the DSM. So we want to be very open, I think, to what's evolving in our sexual lives and our gendered lives, and how we are as people. Okay. I hope this all makes sense to you. But anyway, thank you for joining me for this quick overview of chapter 12. I'm sorry, chapter 13. And I will see you in the next chapter. Bye for now.